BDHP's role to help to facilitate and enable consumer engagement for, in Queensland in the health research space. I just thought it would be a worthwhile thing to just give you a quick overview of the work that we've done at Queensland Genomics in this area over the past 3 or 4 years, and just have a conversation with you about what the challenges are to really meaningful and robust consumer engagement that you see in the system. And from that, perhaps we can talk about what BDHP could do to facilitate better consumer engagement from where you sit. So as a part of the Queensland Genomics delivery plan, we were tasked to establish a community advisory group. It wasn't clear whether or not that community advisory group should be made up of health consumers or what types of members of the community. So we decided to set up a community advisory group that was representative of the Queensland Genomics community, not just health consumers, but we wanted to include clinicians and researchers and health administrators as well. So we ended up with a dozen or so people from quite diverse backgrounds, ranging from consumers to clinicians and researchers. You'll see many familiar faces in that group there. The group has been involved in Queensland Genomics funded projects through regular quarterly meetings where we discuss community advisory group projects, but also the Queensland Genomics program and the consumer engagement activity that is happening within each of its funded projects. We activated the community group members in the co-design process that we used for selecting projects in round 2. And this process helped projects to identify and address issues that were identified from the patient perspective. Interestingly, a lot of our round 2 and beyond projects included patient representatives on their steering committees. And we thought that was a good way to just continue to have that consumer voice in the project and to build capability and capacity within health consumers within these specialised areas. And we've also liaising with our clinical projects on what they're doing in the community engagement space. And so we've asked them, once they do get up and running and they've had a chance to meet with consumer representatives, they need to come back and tell us, all right, what have been the issues identified from that consumer perspective? And are there any changes that you've had to make to your project to address those issues? Another thing that we've done is once the community group got up and running and developed its strategy and plan, in round 2 and beyond, Dave gave us some funding to identify and deliver on some community-led projects. So we ran a process with the community advisory group where each of the members were able to pitch their idea as to what they thought would be a worthwhile investment for Queensland Genomics to make in a community-led project. And we had a number of really worthwhile projects in the ensuing years. One of those things was a patient communication toolkit, which one of our consumers from Bundaberg, Gary Hondo, who's the father of a child with a very rare disease, and his experience within the health system was that there's often a lot of assumptions made about what patients know, and they thought they'd had whole genome sequencing, but they'd really just had panels, or there was really a disconnect between the understanding of what the variety of tests that are available. So we worked with Gary to develop some information resources to help to address that disconnect. We also saw that there was a big lack in consumer understanding of what genomics could do in the health system. And I think it's that kind of general understanding in the community has come a long way in recent years. But one of the things that we've done is partner with Health Consumers Queensland to deliver some genomics education sessions at their annual forums in 2018 and 2019. We also had some projects that were designed to improve health service delivery for health consumers. One of those is to scope the needs from a genomic support network for Queensland patients. Rare Voices Australia, which is the national peak body for rare diseases, has recently worked with stakeholders and the federal government to develop a national strategic action plan for rare disease. And that was signed off with bipartisan parliamentary support at the Commonwealth earlier this year. Obviously, to bring that to life through the states, there is a need for some activity at the state level. Most of that's brought to life at the state level. And a lot of the other states have a support network that's designed to help patients navigate the system in this area. And so one of our community advisor group members said, well, I think we need one of those for Queensland. And so rather than go ahead and set that up, we thought it was important to talk to a lot of the people that would use such a service and help their help in designing, if we were to establish a genomic support network for patients, what should it do? What challenges would it face? And like, where should it sit? How should it operate? So we're undertaking that process at the moment. We've got a engagement session planned with about 40 patient group representatives in November. One of the other projects that we ran, thanks to the Community Advisory Group, was Genomics Literacy in Multicultural Queensland. One of the genetic counsellors in our group, Lindsay Fowles, identified that when she does consultations with people from different multicultural backgrounds, often the interpreter doesn't necessarily have knowledge of genomics, and it may well be their first exposure to this area of the health system. So we developed and delivered education sessions for health interpreters last year, and we delivered those face-to-face last year. We only had space for 60 people, but we were really overrun with interest. We had a waiting list of nearly 200 people. So we've delivered it again this year, but we've done it online. And we've also invested in evaluating that process. So it was something that we worked with Kiama Berghofer to develop, and Lindsay Fowles on the clinical side. And that program has been really, really very popular with interpreters. And I think one of the things was, this is such a group that has been not necessarily had a lot of time and investment made in them. So I think that's part of the reason why it was so popular. And a lot of them asked, wow, would this be really useful for us in other areas of health care as well. We've also invested in a number of community-led research projects. So Aideen McInerney-Leo has led a project to interview rare disease patients in Queensland and Victoria, just to determine the different ways in which genetic health services are accessed in those different jurisdictions. In our involvement in Health Consumers Queensland, we conducted a survey of people who attended to determine their self-rating their genomics knowledge versus their knowledge of navigating the health system. And there are some interesting findings about that. So she's also leading a project to write a paper about that. And as I mentioned earlier, our Genomics Literacy in Multicultural Queensland project will develop an evaluation of the accredited education courses that we did for medical health interpreters. Really, I wanted to hear from you all, though. I'm sure you're all experienced in engaging with health consumers and a lot of the work in your areas. And I'd really just love to hear, to begin with, you know, what are some of the challenges and the barriers that you face to engaging with health consumers meaningfully? Because we just want to make sure that whatever we do at BDHP supports the research community to be able to get what they need out of health consumers, but also supports health consumers to be able to contribute to health research in a meaningful way that will actually affect better patient outcomes.